I've got the pleasure of speaking with Daniel Owusu. Daniel, you met a good friend of mine in the VA hospital where you work, and you were introduced to Mito. Could you please tell me what your health concerns were prior to that?
So before I met Mr. Randy, I had severe acid reflux disease. Um, what happened is anytime I ate, within a couple hours, I feel burning sensation in my chest, and then this pain will move up my throat, and then stays there for sometimes 2 days or 3 days. And within that time, I wouldn't be able to eat or add anything to whatever I ate. So it was pretty bad. I went to see GI people, um, and then they gave me what we call the proton pump inhibitors, PPIs for short. They actually put me on esomeprazole initially, thinking that would help, and that did not release relieve the symptoms or the pain that I was having. So they switched me to the newer medication called Avocanza. It treats or it helps to treat the same acid reflux symptoms, but then for in my case it wasn't helping. So what had happened was I went to see a surgeon, a GI doctor who is also operates on people with GERD or the gastroesophageal reflux disease, and the plan was they were going to do surgery to see if that will help fix the problem I was having, since the PPIs were not doing the job. So they had me scheduled to go to do the surgery, and I went in. They prepped me. They put IVs in, and on my when they were about to send me to the operating room, all of a sudden my heart rate started acting funny on the screen. My heart rate was very low, and this machine was just beeping all the noise. The nurses were coming in and checking me out. So the doctor ordered an EKG to see what is actually happening. And when they did the EKG, all of a sudden they seen this what we call the premature ventricular contractions (PVCs). And what happens every single other beat was a PVC. And in the medical term, they call it by Germany. That means when the heart beats and every other beat, we have this big old PVC showing up. I'm concerned, and the anesthesiologist came and talked to me. I looking at the EKG, and he said, "Daniel, we have to cancel the surgery because now with this PVC was not known to us. Now that we know, we cannot continue the surgery." So they canceled the PVCs. They canceled the surgery, and they asked me to see a cardiologist. So I did schedule an appointment with the cardiologist. Went to see him. They did an EKG again, and the PVCs were showing up. Lo and behold, the same thing that was showing up there at the hospital was showing up at the cardiologist's office. So he put me on some low dose metropole. And for me, being a nurse and also a registered therapist for almost 2 decades, I know what this do, and I always talk to my patients. Each time you take any form of blood pressure medication, you have to check your before you take it. So I took my blood pressure anytime I have to take this metropole just to make sure my blood pressure is not low to begin with, because that can bottom the pressure down and then get me in trouble. So after about a week or so of taking the medication, I saw that my blood pressure was getting a little bit low. So anytime I had, I didn't take the medication. If I checked the blood pressure and it was low, I didn't take it. And then I still have about half of the bottle left of the medication they gave me to treat the PVCs. Yeah, so that was a condition before I met Mr. Randy. And it wasn't getting better. It was actually the acid reflux was still there. I lost a bunch of weight actually as a result of this acid reflux disease.
Hmm.
Initially, before I was weighing 193, 194, and within few months after the acid reflux started, I lost almost 50 pounds. My weight went down to 145, 146. It was very, very bad. My whole family was concerned. Um, yeah, so it wasn't a pretty picture.
Hmm. Okay. So the operation was attempted in December. You meet Handy Randy in April. What
Yes.
started to change, and what was the first thing you noticed?
So after I met Mr. Randy around early April of 2026, which is this year, when he introduced me to Mito, I ordered the bundle, the restore, rejuvenate, and the body and brain.
Mhm.
So I started with the restore. Now it did say 4 ml is recommended. So one time the first time I took it, I ate. I was about to go to work. I work night shift at the VA. I was about to go to work, and then I ate some small food, just rice and I believe some sardines. But those are the food I could eat without too much of a problem. All of a sudden, couple hours after I ate, I started feeling that sensation again with the heartburn, and I'm
Mhm.
like, oh boy, this is this is not going to look good for me at work. So I took 4 mls of the Restore, and then I just head my way down to work, thinking that I'm just gonna have problems when I go to work. I just went, took my report, and then within a couple hours, all of a sudden, this sensation that was supposed to get worse actually it stopped. I didn't feel the pain in my throat anymore, and I'm like, okay, what's going on? So then the whole night went by, and the morning, my stomach, I started feeling this growling sensation in my stomach. That means, oh man, you're hungry, you need to eat. So I went home, and I'm like, okay, something is different. That's the first time I knew that something was up. So from that time onwards, anytime I ate, I took the Restore just to be sure that I don't get the burning sensation in my throat.
Okay. So you go to the hospital looking for one situation to be resolved. They find out you have another. And how did the doctors see the heart problem in relationship to your acid reflux problem? Was that no concern to them? How did they compare the two?
Oh, now when they figured out what was going on with the heart, now the PVCs, now all of a sudden that acid reflux became a minor issue, and the heart issue became more like a priority, because then all of a sudden, I'm coming here, I'm there for them to treat the acid reflux item. Now something else much bigger and worse was coming up, because the heart, they saw the cardiac issue as an emergency, and they thought the surgery could fix the acid reflux, but we need to make sure your heart is functioning before we go do the surgery. And being in the healthcare, I know, doctors, they take patient safety very, very seriously. So at that part, I really, in a way, I'm glad that they did that, because it showed that, okay, they're taking my health very seriously. And but then again, yes, that heart issue became more of a priority at the time. So for them to cancel the surgery, that was very significant. They usually don't do that at all unless it's very, very bad.
So were you able to make any progress with that heart condition between the December and April when you meet Randy, or did you still have it just as bad when you met him? How would you assess it?
When I met Mr. Randy, the problem was still there. Because the PVCs that they had, discovered on the at the hospital on the day of surgery. I work in a hospital, and sometimes, we able to check to see, without trying to get into any form of. There are machines that we have, the EKG machines, and sometimes if you have to test it out to make sure it works, trust myself, and I was able to still see the PVCs. So, just to verify for myself. Now, machines, the medical equipment, most of the time they work pretty good, but yeah, to just make the answer to the question is yes, the problems were still there, and they were not gone before I met Mr. Randy.
Okay. How long after meeting Randy and getting started on MITA did you see any change in that?
Oh, it was like, almost weeks, because I saw Mr. Randy in the beginning of April of this year, and we are today is May, so like less than 2 months, and I went to see my cardiologist a couple weeks ago, for them to well, as a follow up to the EKG that was done at the beginning of the year. And when they did the EKG, I wasn't expecting to see anything different in my heart conditions, because the PVCs were there and I had not checked it to see what's going. So when they did the EKG at the doctor's office, the I was looking at the strip, and I was hoping to see some PVCs, and there was none. I mean, I'm the peeking through it. I'm like looking at it because I know how to read these EKGs. So I look at it. I'm like, okay. So I kept my mouth shut. The doctor came in. He said, Daniel, what happened? I'm like, something. He was shocked. He was shocked. It's like now there was not one single PVC on the EKG strip, not even one. But before then, the last time I saw him, every single other beat was a PVC just showing up right on the strip. And yeah, but now nothing, not even a single PVC coming up on the strip.
Wow.
Yeah.
What a blessing.
Oh yeah.
Uh, you had two issues. Thought you had one. Ended up having two issues. The heart one being even worse. And within weeks after being on Mito, it seemed like things were dramatically changing.
Oh yeah. So the I was more concerned with the axle reflex, because that was the one I could see immediately. Because when I eat, I could feel this. It just comes right away. Now I was hoping that maybe after we fix the axle reflex, the heart condition may get better. But then again, I had scheduled some meetings with the cardiologist. So I'm hoping that, okay, let me fix the axle reflex part, and then maybe cardiac part may be addressed. But then it happened that when I went to see the cardiologist, the cardiac thing just reversed. It just went away. So I'm like, okay, I was taking this product for one thing, and now the other part that I wasn't even expecting just became almost like a side benefit. And it just yeah, it was awesome. It was good.
Okay. You know, our approach is just to regrow mitochondria. We like to say we don't do conditions, we do mitochondria. But when we do that, it empowers the person's body to fix you in ways that it couldn't do before because of, the difference in the cellular energy level. Now, but it'll work on everything that your body decides what to work on. So did you notice anything else, mentally, physically, or emotionally? Did you notice anything else since you've been on Mito?
One thing I noticed now is my weight has started coming back up. Now I'm here in North Carolina right now, and yesterday we had a bunch of food. Um, I mean, you name it, all sort of food. Before I met Mr. Randy, when they cook the food, I have to eat mine separately, because they have to add the tomatoes and onions and all the food that will cause the body to produce more acid. I wasn't able to eat them. But yesterday, I ate everything right on here. I ate them. I just went from table to table, and I was just eating them. My stomach started getting big. I'm like, okay, no, this is good. Yeah, but before then, I wasn't able to eat it because I was afraid to eat it. And you know, between yesterday and today, I haven't had a single episode of this acid reflux problem. Yeah, and my weight is coming back up now. My weight was down to like 147, 149. I checked my weight this morning. It was 161.4. That's within what few weeks after taking this medication. I keep saying after taking this product. The yes, so it's really really helping, and I'm
so,
excited.
so I imagine you feel physically stronger as well.
Oh, I got more energy. See, and we have a tent. We just put this tent yesterday. I can turn this here. This goes for the birthday. Um, we have to use a ladder. I mean, this is a big old long. I was able to carry that thing by myself, brought it up here, set it up, and then we were to climb up just to put this thing up. We went out to grab some chairs, and I'm carrying this thing around. Like, okay, now able to do some more exercises, able to go back to lift my weight. Yeah, so the energy has been better. But before then, I could hardly do anything, because if if you don't eat, you lose energy, and that's exactly what's happening to me. I will move
Hmm.
around. I become tired, and I wasn't able to lift up anything. But now I'm back to lifting the weights again. And yes, very,
So
very.
during the course of all this, was your mental acuity, your regularity, your vision, were there any other things, any other aspects of your health that were affected or that might have changed?
I think I think my it was it's affected my memory a little bit. And that's one other important news too. I was trying to study for in a project. There's something called project management. I did some schooling. This is new, but within I passed. I was able to take and pass the PMP. Um, that's what in April 20th of this year, and that's some few like couple weeks after I had met Mr. Randy, because I was taking the body and brain, the whole thing. It got my mind was clearer. I was able to study and retain the information. So the test was actually scheduled to be taken, I believe the 20th of this month, but I changed the date to April, April last year. I went to the test and I was able to pass. That's a that's in itself, it's a miracle, but it's because my brain it's got more clearer to study, and I was able to retain more information. Um, yeah, so that's another side benefit too that I wasn't expecting.
Well, well, thank you for sharing that, Daniel. I really appreciate it, and for letting us be a part of your wellness journey.
Oh, you're welcome. Thank you very much for the product. It's helping a lot of people, and telling the folks about it. And I hope that more people can see the benefit and be able to to take part of this. This is a great journey, and I'm great to be part of it.
I see you wear glasses. Did you notice any changes in your vision at all?
So these glasses is meant for reading far. Wait,
Hmm.
so it right now I haven't really seen.
No, take your glasses off. Now look at a distance and see what you see versus what you would expect to see.
One birthday. See, that's the birthday thing right there. Before then, when I started to read it, I don't know if you can see it.
I can see it.
Yeah, before when I'm reading it, it will become fuzzy. But
Yeah,
now I can see one birthday to rule them all. That's it's not as fuzzy as, oh, sorry about that. This thing fell off there. It's not
okay.
as yeah, it's not as fuzzy as it used to be. Um, it's not as clear as I want it to be, but at least I can still read it and it's not all bundled up. But
Yeah,
it's getting better.
so your vision is starting to improve.
Yeah,
And how long have you been on it altogether at this point?
the more Mito.
Yes.
So I took it around the middle of April. Because
Okay.
yeah, I think when I saw Mr. Randy, that's the beginning of April, and when I ordered it came pretty quick, but it said somewhere around April, the middle part of April, so a month and some few days. Yeah,
Okay. So you have many more benefits in store as your mitochondria starts rebuilding things.
yeah, yeah. It's I feel like it's affecting just more than one body system, because with the GI issues that's correcting, and then the cardiac, and now the vision is taking longer, but at least it's getting much better too. Yeah,
All
yeah. I
right.
think over time it's gonna get much better than this.
All right. I'll stay tuned for the next exciting episode.
Yes, sir. Yes, sir. That's
Awesome. All right,
yes.
Daniel, take care.
All right, you too. Thank you very much.